On today's Two on Your Side Town Hall, COVID hospitalizations, Omicron, vaccine news, changes in pro sports, holiday gatherings. A lot to discuss as one of our medical experts will join us live.
Plus, Verify looks into the claim that you could get some cash just for using Zoom on your computer or your phone. Is that legit?
And Bruce weighs in, number 78, with his thoughts on plans for a new stadium for the Bills, what he wants to see and what he doesn't want to see. Coming up.
We are glad you're with us on this Monday. Thanks for being here. We're going to start with the continuing COVID issues here in Western New York and possibly a sign that things may be headed in a better direction.
We always keep a very close eye on hospitalizations caused by the virus, and that number peaked back on December 9th with 537 Western New Yorkers in the hospital. It was close to the all-time record high that happened on December 10th of last year, almost exactly a year ago. Well, the good news is, as you can see, that number has been dropping nearly every day. It got down to 486 on Saturday, and then you can't see this on the chart, but literally about 2 minutes before we walked out to the studio, we got yesterday's number, and it dropped by another 13 patients. We're now down to 473 in the hospital.
It's following very closely to what we saw last year, which also brought another peak of hospitalizations right after Christmas. So joining us live now to talk about all this, Dr. John Sellick, hospital epidemiologist for Kaleida Health. We have a lot to talk to you about, so we appreciate you coming on, Dr. Sellick.
Thanks for having me. This is, we're getting whiplashed again.
Yeah, exactly. It feels just like this point last year. We're going to show that chart again in just a moment because we want to get your take first here on the state of our local hospitals. Still a lot of COVID patients getting care, but it is good anytime you can see that number going down. Are we seeing significant improvement in your estimation?
Well, we're definitely seeing a little bit of decline in hospitalization. Unfortunately, many of the ICUs still have a large number of COVID patients on mechanical ventilators, and that's a group of patients that's much more difficult to move any place. So at the moment, our test positivity has gone down a little bit, and our hospitalization rate has gone down a little bit. But as Kate mentioned during the lead-in, we saw something very similar last year, and now we're going to get the double whammy of the holidays in this new Omicron variant that appears to spread much more rapidly than even Delta did. Everybody thought that Delta was probably going to be the worst ever, but it looks like Omicron is going to be worse. Now, if it turns out that Omicron doesn't cause quite a severe disease, that's wonderful. But if it really winds up causing very large numbers of infections, there still will be more people who need to get hospitalized, will get significantly ill and potentially die.
On that note of the Omicron variant, excuse me, I'd like to get your reaction to something the U.S. Surgeon General said this morning. He was talking specifically about the Omicron variant, and like many experts, he believes that we'll see a huge spike in cases in the coming weeks because it is so much more transmissible. But he went on to say that we'll see a huge difference between those who are vaccinated and boosted and those who are unvaccinated. And he actually said, quote, "If you're unvaccinated, I am worried about you." Does that match up with what you've seen with Omicron so far?
Absolutely. I think that when you look at, the experience so far is that this spreads incredibly rapidly with this very short doubling time of 2, 3, 4 days. So we will see very large numbers of cases. And again, even if it's less severe, which it's not 100% certain that it's going to be less severe, even if it is, a small percentage of a very large number of cases is going to drive this. I think most of us are looking for, January and February are probably going to be very unpleasant for us, that there's going to be a, between 4 and 8 week surge of cases that will, again, disrupt our lives and put people in hospitals and things like that.
On a similar issue, Doctor, Moderna put out lab results today that says that its booster shots dealt pretty well when it comes to Omicron, though it still plans to work on an Omicron-specific booster. Of course, a lot of us heard Dr. Fauci say last week that he didn't think we were going to need a specific booster for this type of variant. Moderna is also saying that it's testing a double dose of its booster. So, kind of multiplying it by 2, but they're worried about potential side effects there. What should we make of this news from Moderna today?
I think this falls in line with what we've seen from BioNTech Pfizer recently. You know that when Moderna went to their third dose, and we've got to start training ourselves to get away from the term booster, because this is really going to be a 3-dose vaccine. But Pfizer used the same full dose for the third dose as they did for the prior doses. Moderna cut theirs in half. So what they're telling us is that they are going to be looking at using 3 full-dose vaccines. Now, their full dose is a little bit bigger than the BioNTech Pfizer full dose, but the long and the short of it with all of these is it looks like these vaccines, when given in 3 doses, will get to good antibody levels that will get back to the original idea of these vaccines, which we've talked about so many times, which is keeping you out of the hospital, out of the ICU, and out of the morgue. We will certainly see some breakthrough infections. There's no doubt about that, but hopefully those will all be very mild. But it looks like this is going to work. The problem that you have if you make a variant-specific vaccine is that it may work very well for that variant, but then degrade the effect on other variants that may pop up. So I think right now, as long as the data are showing that 3 doses of our current vaccines are going to work very well against the bad outcomes, that we're probably going to continue to ride that horse.
One of the things that's sort of really noticeable about the impact here is that we've seen COVID disrupt sports this last week in a way that we haven't seen since the start of the pandemic. The Sabres game tonight is one of dozens that have been postponed. The NHL is shutting teams down for a week and increasing testing. The NFL, meanwhile, is loosening rules to test vaccinated players less and get players who test positive playing again faster. It's certainly very different approaches. What do you think about that? Is the NHL being overly cautious, or is the NFL being a little too loose?
I guess that's a double whiplash there. You watch what they talk about. I think we have to go back to the basics of this, and that is that we want to decrease the spread as much as possible, because even though you want to bank on the fact that Omicron is going to be less severe and that the players are younger and healthier, you get this spillover effect that we always see. So they may take these infectious variants home to other people in their families, other people in the organization who don't have necessarily as good an outcome. So I think that you have to look at it. It gets into very specifics about how many days a week are you going to test this group versus that group. And I think you have to look at it more that just saying we're going to let this run loose is probably not going to be the best approach. And the NFL has already been called out in a number of different media formats for this. So we'll have to see how this works out. And hopefully this is not going to blow up just because they want to get games played, that we don't wind up with outbreaks that result in people being harmed.
Finally, Dr. Sellick, we're almost out of time, but people have already made their holiday plans at this point. We're not here to tell anybody to change them. It's probably a little late for that. But for folks that are planning to get together with family, and I'm sure you've heard this from your patients and other people just kind of asking you, what are your recommendations for people if they want to try to do this safely? Is it going and buying one of these rapid tests or making sure everybody's vaccinated?
Well, Michael, you're absolutely right. This has been the question of the last couple weeks. And I think you have to go back to that idea of layered protection. So I think minimizing the size of the gatherings, making sure that everybody has all 3 doses of the vaccine, not crowding too much, keeping windows open, using portable HEPA filters if available. The testing can be of benefit. The thing that we worry about with testing is someone saying, well, okay, I'm going to grandma's on Sunday, I'll get tested today. That's not going to work very well. So ideally, you should test maybe a day or 2 before Christmas or Christmas Eve, whichever is being celebrated, and then again before you go to that particular event. And if both of those are negative, it's not a complete get out of jail free card, but it will greatly decrease the risk. But if you just do one of these rapid tests a day or two before, I would not bet that that's going to help things very much. So I think looking again at the big picture of all the things that we know that work to prevent this transmission, especially in these family gatherings, there will be many higher risk people on the basis of age and underlying diseases and other similar risks. So you want to be as careful as possible.
We so appreciate the perspective always. Dr. John Sellick has been our guest. Dr. Sellick, thanks again.
Thanks again. Merry Christmas.
Merry Christmas to you.